Hey YouTube, it's your girl Iman. Wanting to check in because it's been probably at least a month since the last time I checked in with you guys. So, talking about my pregnancy after weight loss surgery. Um, yeah, you see I'm in the parking lot. I got like 10 minutes. So I'm trying to make a quick video. But I just want to check in with you guys. I am 18 weeks. So almost to the halfway mark. I'll be delivering about 38 to 39 weeks. 39 weeks at the latest. But if I go into labor naturally or uh, the doctor sees any reason to deliver earlier, we will. But 39 weeks is the latest. So I'm almost to the halfway point. And yeah, I'm excited. I'm excited. I still feel like I got a long way to go, but October is halfway over. Today is the 15th, the 14th, Friday the 14th, and it's so time is flying in a way. In a way, it's not. Anyway, so I just wanted to check in. Like I said, I am currently 195 pounds this morning. Some days it's 190, 192. And it's so strange. I'm trying to control my weight gain. I was so successful last time, and this time I don't know, like my body just wants to hang on to weight this time. I really strive for high protein. I really strive for healthy snacks, and that's not to say that I haven't had any chips or cookies or anything, but I don't eat them daily. I cook more, trying to control my intake, and I just keep gaining weight, and it really makes me sad. I really wanted to stay under 200, and I just don't know if I'll be able to this time. If this is anything like my first pregnancy, I did gain a lot of weight in the first half, and the second half I didn't gain nearly as much weight. And I actually even started losing weight the last 2 months. I don't think I revealed. I am expecting a little boy, so that could be, if it's true that you can compare pregnancies to the sex of your child, then maybe the weight gain is because I am carrying a boy. Because I gained a ton of weight with my son. Like I said, I'm not on track, the same track I was on with my son. But even with him, even though I gained like 60 pounds. Yeah, I gained like 60 pounds. And I was already obese to begin with. But by the time he was 6 weeks old, I went to the doctor. I was within 5 pounds of my pre-pregnancy weight. So I pray that my body does the same thing this time. With Zaria, I was back down to pre-pregnancy weight by 6 weeks appointment. So hopefully my body will do the same thing and get back to pre-pregnancy weight within 6 weeks. But I don't know. Anyway, so I did want to check in. I'm having a uneventful pregnancy. I am starting to have some pains with what is it, like the what do you call it? Where your joints start to loosen up. My doctor said it's kind of early for that, so she thinks that maybe I need to see a physical therapist. Um, she gave me a referral. Waiting on them to give me a call and see what's up. But yeah, I'm trying to think. I did the blood test, the panorama, panorama. is it pregnenolone blood test, and that's how I discovered that, or how we found out we were having a boy. And it's low risk. All of the genetic markers that they look for, low risk for everything. And I have my ultrasound, my 20 weeks ultrasound coming up, like around the 1st. So of course they'll be able to look and see if they see anything. But as far as the blood work is concerned, that came back positive, in a positive light, I should say. Everything is looking good. I feel fine. I had morning sickness early on. I haven't been sick in probably about 2 months, and I'm still going to the gym. Not every single day, because some days I'm just too tired, and I have the kids and my husband's work schedule. Just as I was working, I'm always trying to get my son's homework done and stuff like that. So, but I still make it to the gym at least 2 days a week. That could be possibly contributing to the weight gain, that I'm not as active as I would like to be. But I mean, my body is tired, but it's still normal. I don't feel abnormal at all. I get tired. That's it. Other than that, I feel fine. So hopefully my energy will come back really strong, so that I can really stay active in this pregnancy on a high note, like with a healthy weight gain, and not exceed that 30 pounds. That I think for the most part, doctors like for women to stay around 30, even if you're overweight. They don't want you to gain more than 30. So maybe, maybe. What else? Video's getting kind of long. I didn't want to make it too long. I'm gonna have to start taking notes and keep you guys informed and abreast. But I always say this: I like to put some kind of video up so that I can be. I don't want to say if it's inspiration. For some women, it might be inspiration. I just met a woman on Instagram who had VSG, and in less than 6 months she was pregnant. And so it happens. It doesn't. We don't do it on purpose, but it does happen. And I know if you haven't reached your goal, or you weren't trying to get pregnant, even if you were, then you're looking for other women or who did get pregnant, and hoping, rooting for them. There's a few women I watch on YouTube who have babies after weight loss surgery, even if it wasn't like quick like me. And so I'm rooting for them, like, make a video, let me see how you're doing, but it's not a lot. So my goal is just to try to remember to make a video every so often, just so you guys could see how I'm doing, and my struggles and my victories. We want more victories than struggle, of course, but struggles are real. They're part of everyday life. And so the most important thing is to not give up, no matter what your situation is, because some people have other medical events that happen, not just pregnancy, but sometimes medical events, medication, pregnancy, those things have an impact on your physical body, and then maybe even your mindset. So like I said, this video is getting long. I'm gonna hurry up and get off, but I just wanted to check in with you guys, and hopefully it won't be more than a month before I make my next video. Peace, YouTube.